Let's discuss defibrillation. Okay, what is defibrillation? Okay, defibrillation essentially is passing electricity through a patient's heart to neutralize all electrical activity to allow the heart to pick up and pretty much start beating using its own normal sinus rhythm. Now, patients who present with ventricular fibrillation or pulseless ventricular tachycardia need to be defibrillated. Okay, and that's one important thing. So that these two rhythms essentially they are uncoordinated rhythms or coordinated rhythms without a pulse, for example, pulseless ventricular tachycardia, that you need to be able to identify on a monitor and be able to provide immediate shock to the patient to allow the rhythm then to pick up. Now, there are two things that have been shown to improve patient survival in a cardiac arrest situation, and that is good CPR. Okay, so push fast, push hard, push fast but not too fast, so 100 to 120 beats per minute, at least 2 inches depth or 5 centimeters, minimize interruptions, okay, and allow full chest recall when you're doing your chest compressions, and of course avoid hyperventilations. So those are the key aspects of good CPR, and that plus early defibrillation. Okay, early defibrillation has also been shown to improve patient survival, and that's why there are many programs that look at how to defibrillate patients in an out-of-hospital setting so that patients are defibrillated as soon as they go into cardiac arrest, because this increases your chances of survival. So up to, if shocked immediately, you go into cardiac arrest, as high as almost 90+% survival with good neurological outcome if shocked early. All right, so defibrillation, for you to defibrillate a patient, you need a defibrillator. There's no other plan B here, okay? You can only shock a patient when you have a defibrillator. And so we're going to discuss how to use a defibrillator to defibrillate a patient. Now, I know you've potentially come across different things about monophasic versus biphasic defibrillators. The thing is, any defibrillator is good, okay? There is no difference in terms of outcomes whether you're using a monophasic or a biphasic. Should you go and identify whether you're having a monophasic defibrillator or a biphasic defibrillator? Yes. For the main particular reason behind this is because the joules you require to shock the patient then potentially slightly vary. If you're using a monophasic defibrillator, then you'll probably start off at 360 joules. If you're using a biphasic defibrillator, then you're using what the manufacturer recommends. And if you want to actually know what the manufacturer recommends, it's actually marked on the defibrillator, okay? Normally there'll be something like an adult dose. Next one just says adult dose. So that's a fast shock that you're gonna use. That's a fast amount of energy you're gonna use to shock the patient. And then subsequently, depending on your manufacturer, sometimes others will recommend you escalate, others will recommend you remain at the same shock. But so you need to know your manufacturer recommendations for shocking. But if you do not know, okay, this is simply just to simplify it all for you. All right. If you, for any reason, you can tell if it's a monophasic, start at 360. If it's a biphasic, start at what the manufacturer recommends and then go to up. If you do not know, for a monophasic, just for go to 360 if you can tell. For the biphasic, if you do not know what the manufacturer recommends, go straight to 200. Okay, so the first shock, especially for biphasic, should be either 360 joules or what the manufacturer recommends, and if you don't know what the manufacturer recommends, just go to 200. Subsequent shock joules ideally should be at maximum, but preferably go online, find the guide from the manufacturer that will guide you on how many joules you're going to shock. Now, what's the main difference between monophasic and biphasic? So for biphasic, essentially you get electricity running twice. So you get electricity moving from one electrode, one paddle to the other paddle. Okay, so one way and backwards, okay? Because of that two-way motion, you're using less energy. So the first shock ideally primes the heart for defibrillation, and then the second shock then defibrillates the heart. Because of that initial priming, then for a biphasic machine, you use less energy to shock the patient. Monophasic just goes one way. But as I want to emphasize, any defibrillator you have available is good enough to be used. There is no evidence that shows one machine is better than the other or monophasic is better than biphasic. Defibrillator is defibrillator, and most studies have looked at it, and if you have a defibrillator, you find out how to use it and use it on your patient, it will work as well as any other defibrillator you may have available in the market. Okay, so so we have our patient here. So I'm just going to show you how to quickly go through defibrillation. All right, remember, when you're doing CPR on a patient, you're normally going through cycles of CPR every 2 minutes, and at 2 minutes, you want to check the rhythm and shock the patient if indicated. Now, let me quickly demonstrate on my monitor what rhythms you're looking for. Okay, so for this particular demonstration, let me just connect the patient with the leads so that I can show you what you're looking for on the monitor. Okay, so I'll switch this one on. All right, now what you're seeing on the monitor is ventricular fibrillation. Okay, even the machine is complaining about it because it's telling me you should be shocking, not having a conversation about this, but this is for training purposes. This is ventricular fibrillation. Okay, and this is a rhythm that you quickly want to identify when you have a defibrillator, and you quickly want to shock your patient to convert that rhythm. As I said, what the shock does, it neutralizes all electrical activity, because ventricular fibrillation is chaotic electrical activity in the heart. By shocking the patient, you neutralize all electrical activity, allowing the heart then to pick up from its SA node and convert to a normal rhythm. Now, I just want to emphasize, let me just switch it off. It's very disturbing to have a VF on the screen. What I want to emphasize is when you shock the patient, you need to resume CPR immediately. Do not check if it has worked. You will check 2 minutes after CPR. So the moment you shock the patient, resume CPR immediately. You will check the rhythm 2 minutes after. You'll check the rhythm after 2 minutes of CPR, because your fibrillating heart is doesn't have blood in it, okay? Because it's just shaking, okay, and it's empty. So your 2 minutes of CPR fills the heart chambers with blood, allowing the heart then to be able to pump blood effectively. And that's why the moment you shock the patient, quickly put back and resume CPR, okay? Do not check if it has worked. You will check at 2 minutes when you're doing your rhythm check, okay? Now, the other rhythm I just want to show you that potentially your patient could have, that is a shockable rhythm, is what we call pulseless ventricular tachycardia, okay? So as you can see it on my screen there, all right? Now, this rhythm is shockable if your patient, let me just mute that a bit. So I will check quickly, is there a pulse? And you should not spend so much time. Ideally, what we normally recommend now is doing femoral pulse checks during CPR so that you know where the pulse is. And the moment they stop CPR, then the pulse disappears, and that means the patient has no pulse. And so this is not... So during CPR, if you have someone in your team, they can put their fingers through at the femoral artery and feel the pulsations that the CPR is going on, so that when the CPR stops, then if the pulsations disappear, means there is no pulse. I don't need to go check the rhythm again, check the pulse again. Now, this is also a shockable rhythm if your patient has no pulse, okay? So this is a shockable rhythm if your patient has no pulse, okay? So we're going to do a quick simulation, okay? Remember, if you're using paddles, then you need to be able to use defibrillator gel. As I said, do not, for application of defibrillator gel, all you need to do is apply just a small blob, okay, on the paddle. And normally you'd have someone, because they normally would not want you to be holding paddles. So you'll have someone assist you, and you have a small blob, all right? Then you place it on the patient and rub, and we're gonna do this in the real-time scenario. Let's quickly go through a scenario where I need to defibrillate my patient. So my patient has just arrived, okay, and they're unresponsive. So I quickly want to check what's happening to the patient. So I'll switch the monitor on, all right? Okay, monitor is on. So someone is doing, there's no pulse, of course, so someone is doing CPR. So I'll quickly make sure I'm on paddles. I'll take my paddles and check the rhythm. From the monitor, I can see my patient is in ventricular fibrillation. So I'll ask my assistant to continue CPR. I'm gonna put some gel. So blob and blob, all right? So I'm gonna put them here, and I'm just gonna rub a bit. So I'm gonna go to 150 joules as recommended. So blob, I'm gonna charge. Fully charged, clear everyone. Shock, put them back, resume CPR. All right, okay? So key things in that whole discussion. So normally you leave your monitor on at where it was. So I just okay? Repeat that again for you to see. So the first thing is I want to do is, so patient has just come, they've collapsed. So CPR is ongoing, there's no pulse, so we are started CPR. I want to quickly check the rhythm. Okay, I still have some gel on. I'll check. My patient is in ventricular fibrillation. Okay, so this patient needs to be shocked. I'm going to charge it. So it turned up to 150. I'm going to charge to 150. Clear everyone. Shock, and I put them back. Okay, and resume CPR. All right. So that's very simple. Using paddles to quickly check the patient's rhythm and shocking the patient if indicated with ventricular fibrillation. When you're using paddles, okay, there is normally some lights here. Okay. All right. Yes. So if you noted, the two things I did. So the first part was place a blob of gel. When I get to the chest, I'm just going to show you how it works. I will spread the gel by just running it, smearing it around the chest so that the gel spreads evenly. You do not want to spread gel across the patient's chest, because if you have a lot of gel across the patient's chest, then there's a risk of electricity cutting through the gel and pretty much causing an arc through the patient's chest. Okay, so that's important. You must make sure the gel is only where you're going to be shocking the patient. The other aspect of it is in the new guidelines, the recommendation, remember, as I said, is you want to minimize interruptions. So the options for minimizing interruptions is, for example, if you know the patient is in ventricular fibrillation, or we're getting there, is having the paddles already. So someone doing CPR, you're having the paddles ready so that the moment it's a rhythm check, stop CPR, check rhythm, charge, and shock the patient if indicated. Now, I want to highlight, as you can see, there's some lights on these paddles here. Okay, so the lights essentially indicate if your contact with the skin is good enough. If it's red, means bad contact. If it's orange, fair enough, but you ideally want to be in the green zone to show that you have applied enough pressure and enough you have good contact with the skin. Now, there are three steps to defibrillation. Okay, step one. Okay, and actually the label step one. Step one is select energy. Okay, how many joules am I going to use? Adult joules, I'll use 150. Step two is charge. Charge can be done from here or number two here. Okay, so there are two parts of number two. So number two is one. So one here, charge is two, and charge can be done through here. And then three can be shock. Okay, and shock can also be done by pressing these two buttons simultaneously. So that's number three, and it's labeled number three. So the shock process is 1, 2, 3, select energy joules, charge, shock the patient if indicated, using, so you can either be 1, 2, 3, okay, or 1, 2, 3, okay. The good thing about using pads, for example, is I can do it remotely by just pressing 1, 2, and 3 without interrupting CPR, and only having the person doing CPR put their hands up. So you do not want anyone touching the patient when you're shocking them, okay? Because the shock has the potential to transmit from the patient to you, okay? So you'll get shocked and very little will get to the patient, and yet the patient is one who needs them. And more importantly, of course, then that becomes harmful to the healthcare providers working the patient. So no one should be touching even the IV poles normal that are next to the patient. No one should be touching those poles. Everyone should be clear. So a good shout of clear and checking to make sure no one is touching the patient before you shock the patient. And this is the responsibility of the person who's going to do the defibrillation, to quickly shout clear, and they themselves also need to make sure they're not touching the patient, because the patient's hand could be just next to them, and then that will end up with them being shocked. So make sure no one is touching, and the person doing CPR can hover, what we call hovering. So they can just have their hands ready just over the chest, but not touching the chest, so that they can resume CPR immediately the shock is delivered. Remember, early defibrillation, good CPR, and minimize interruption. Your whole shock cycle for this CPR should be less than 2 seconds, because, for example, someone is doing CPR, so CPR is ongoing. Okay, I've taken my paddles, CPR is ongoing, I'm like, pause, my rhythm check shows VF, so resume CPR, I'll charge, okay, and shock the patient if indicated. All right, so that's the key things to this. Okay, making sure that you are what we call pre-charging the defibrillator. So you can also, what we avoid though is you do not want to move live paddles around. Okay, you don't want to move around with paddles that have electricity, because that could easily discharge and shock a patient. All right, so those are the basics of defibrillation. Going through key things is identifying the rhythm. Okay, so patient who has collapsed, initiate CPR. Okay, initiate CPR. When you're ready, check the rhythm. If it's a shockable rhythm, whether it's ventricular fibrillation or ventricular tachycardia without a pulse, then resume CPR, charge the defibrillator, 364 monophasic, recommended 150 or what's recommended, or 200 for the biphasic or what's recommended, and then once you're ready, stop CPR, momentarily pause CPR and shock the patient. Should be less than 10 seconds. Shock the patient and then resume CPR, and until the rhythm check, the next rhythm check in 2 minutes. All right. So that's the key things in defibrillation. All right. Good. Thank you.